Hello again, I'm Dr. Nunez with Living Health. Sometimes get the question, I have palpitations. My heart goes pitter patter, racing, or I have an arrhythmia, most commonly atrial fibrillation. So what can I do about that, doc? Well, the first thing is, yes, definitely always consult your doctor, consult your cardiologist, and talk to them about it. But there are a lot of things within the realm of lifestyle, of what you do every day, how you choose to live your life, the choices you make in your lifestyle on a daily basis that can impact arrhythmias, palpitations, those sorts of things, or can help with the treatment of it. So before we get into that, yes, this is a series of lectures on lifestyle medicine. This is what this is all called. If you like these kinds of things, press that thumbs up, press the subscribe button, press the little bell. It really does help. Make a comment. Perhaps we can do a video on something that people are interested in. So let us get back into it. Arrhythmias. My heart is going pitter patter racing, or I have atrial fibrillation or flutter, or what can I do? Well, there are a series of things involved. And there are some arrhythmias that can be very dangerous, so always make sure your cardiologist or your healthcare provider has cleared you to do some things or to take some action on your part, but always take their advice seriously. Now, palpitations, that may just be your heart racing. You know, one of the things that we commonly see today is that people are drinking too much caffeine. I have people sometimes that come in and say, oh, I'm drinking 6-8 cups of coffee a day, something like that. That's an extraordinary amount. And yes, something like that can make your heart run, and you might feel like your heart is pounding out of your chest. So watch out with excessive caffeine intake. You usually try to tell people, well, if you want to have your coffee in the morning, you have your coffee in the morning, but the rest of the day, try to come off it. Caffeine, by the way, is also in the sodas and a lot of the Cokes, Pepsis, those kinds of things. It's also in chocolate. It's also in tea. So some people are taking green tea for health benefits. Be cautious if you're having palpitations or you're having arrhythmias because it does have caffeine. There are other natural herbal teas that don't have caffeine. What else is there? Sleep. Sleep can have an impact on arrhythmias, on palpitations, and the like. If you're not getting restful night, in particular, if you suffer from sleep apnea. If you do have sleep apnea, then definitely you need to address that because that can assist in the management of arrhythmias. If you're not getting enough rest at night, that can also contribute to your developing an arrhythmia. So focusing on sleep, I have some lectures on tips for sleeping well that you could look at as well. Make sure as you decrease your caffeine, that might help you with your sleep as well. So these things, what we're trying to create with lifestyle is a virtuous cycle. So one change feeds into another and improves another and then you're going all the way and doing all positive changes and developing positive habits. What else? Weight. If you are overweight, losing weight can help you in preventing an arrhythmia, or it can help in the management of one as those things develop. And again, weight is one of those things that will feed back into sleep, because if you are particularly overweight, you may increase your risk of sleep apnea as well, and that can increase the risk of these other things. If you're not getting enough sleep, then you might want to say, oh, I need to drink coffee because I don't feel energetic. So you see again how it's all these feedback. So yes, if you have a weight issue, try to address that. And nutritionally and lifestyle, what we like to emphasize is plant-based, plant-predominant whole food eating. So you try to eat more plants, fruits, and veggies in your diet every day. So you're filling up on things that have fiber, that things that are natural, that things that are not processed. Always when you're looking at eating your fruits, remember the saying I like to use is don't drink the juice, eat the fruit. Okay, so when you're juicing, when you squeeze an orange and you drink the juice, all you're doing is concentrating sugar. And that's not what you want to do, and you're getting rid of some of the fiber in the fruit. It's better to eat the orange than drink the juice. It's better to eat an apple than drink the apple juice, for instance. Okay? So fruits and veggies in your diet will help you manage your nutrition and maybe help feed into any overweight issue and feed into all these other cycles as well. And another point I wanted to make with that was diabetes and blood sugar issues. If you have some of these things, that might predispose you to arrhythmias. So that's where nutrition will also help you manage diabetes, which feeds into these other things. There's also, I have another talk on high blood pressure and hypertension. If you are hypertensive, it can contribute to increasing your risk. So nutrition can help with that. And there's a program called the DASH diet. There's also the Mediterranean diet. If you look at these things, they're mostly plant predominant ways of eating. And yes, it doesn't mean you have to be vegan or vegetarian or those sorts of things, but if you can get that extra little bit of fruit and vegetable in your daily routine so that you're not eating as much of the meats, the animal products, or the highly processed things, that can be a big help. So what else? Exercise. Exercise is medicine. Yes, physical activity. If your cardiologist has cleared you or your healthcare provider has cleared you to remain physically active, you definitely should. That can help in the management of atrial fibrillation. It can help in the prevention of atrial fibrillation, which is the most common kind of arrhythmias we tend to see. It can help you manage your energy levels during the day as you exercise, and exercise can help you sleep at night better as well. It can also help you with weight management. And so you see how the virtuous cycle starts, and as your energy levels improve, as your sleep improves, as your weight management improves, you might not need as much caffeine too, so your desire for caffeine may go down as well. So these are different components I wanted to encapsulate on how you can target the issue of arrhythmias, of palpitations, of things like that. The other component that I wanted to bring into play are other disorders that might affect your electrolytes. You know, if you're working out a lot and sweating a lot and you're not replenishing electrolytes, that might contribute to arrhythmias or palpitations. Some people are taking supplements. Be judicious with that. Be careful. If you're taking things like magnesium that some people take, that can contribute to issues if it's too low or too high. So don't just pop magnesium willy-nilly without the supervision of a healthcare provider too. So to encapsulate, sleep, exercise, nutrition, avoiding toxic substances. If you're a heavy drinker, alcohol can contribute to arrhythmias, so you want to prevent that. Tobacco can also contribute to the development of arrhythmias or can complicate the management of arrhythmia. So if you can eliminate that, that's also important. And as these things come into line for you, you'll start to notice either you can resolve the arrhythmia, you can prevent one from happening, or you can make the management of an arrhythmia you have easier for you, and you can increase your life expectancy, your enjoyment of life, your energy levels. That's what lifestyle medicine is about, maximizing your health and your sense of well-being and enjoyment of life in good health. If you're getting frustrated with your lifestyle changes or the like, look at that again. Maybe there's something that you can do to tweak, to change. Don't get overly frustrated. What you want to target is that you're improving your lifestyle to maximize well-being. That's what it's about. So again, if you like these kinds of things, press that thumbs up, press that subscribe button, press that little bell. It really does help to have subscribers, and leave a comment if you want to listen to a particular subject area. If enough people comment about something, we can talk about that too. So again, I'm Dr. Nunez with lifestyle, medicine, living health. And until next time, live well. Bye-bye.